Hello, this is Catherine Marie, and you're listening to Long COVID Real Talk podcast. We have a special treat today. We have Dr. Meg Anderson. I'm going to read her little bio here because it's very impressive. She is a doctor of physical therapy with 12 years of experience. She's also the owner of a private practice called Rising Tides Restorative Training, LLC, which was created specifically for long COVID rehabilitation. She received her Doctor of Physical Therapy degree from Northeastern University in 2013. Her time there, she was recognized with various awards and recognized for leadership, entrepreneurial, and innovative spirit, volunteerism, and community engagement. And since then, she's spent nearly a decade working in acute care and acute rehabilitation. From 2020 to 2023, she spent hours, days, and months in isolation working with people severely ill with COVID and saw firsthand the devastating effects that long COVID can have on the mind, body, and soul. She quickly realized this group of people was being left behind, and this fueled her mission to launch her private practice in 2021. Her persistent curiosity and growing dedication to long COVID treatment has led her to become engaged in advocacy for the long COVID population, having attended the 224 U.S. Healthcare Leadership Summit on long COVID rehabilitation. She's also been presenting her work on long COVID to university physical therapy programs, state, regional, and national level APTA chapters. And recently, she was published in the Cardiopulmonary Physical Therapy Journal special edition on long COVID. So, Dr. Meg Anderson is a humble and determined COVID rehabilitation specialist who believes that in a world where long COVID doesn't have a clear-cut cure and is often dismissed, it is her calling to teach the public that the physical therapy profession has a breadth of knowledge to handle this emerging condition, while also providing PTs and PTAs with the skills to deliver it. Great. Fantastic. I couldn't have said it better myself. So before we get into all of the stuff that you're doing now for long COVID, can you tell us a little bit about what you were doing before long COVID?
Yeah, sure. And, it's so funny hearing that read out loud. And you go, oh, wow, wait a minute. All that? All that? And I mean, because we're only 5 years into the pandemic, which, only 5 years sounds crazy, but it's still very early, in the scientific world and things.
Right.
But yeah, I mean, as the bio says, I'm, by trade a physical therapist. And so before 2020, I was working in a hospital-based setting and acute rehab, which is the setting where people get discharged to if they're not ready or able to go home from the hospital. And it's crazy because if, 12 years ago when I was a new grad, you had told me I was going to be a long COVID rehab specialist, I would have looked at you and said, what's that?
Yeah, right.
Right?
None of us had any idea.
It's so wild. But here we are. And so, yeah, I was in the hospital setting and I had basically just landed my dream job. I had transitioned within my hospital system to a place closer to home. And I was like, yes, this is it. Less commute, great community hospital, great rehab, all the things. And working with stroke and traumatic brain injuries and amputations and all these really complex trauma cases and lots of cardiopulmonary cases. Loved it all, right? The more intense, the better.
Mm-hmm.
And then 2020 came along and in a matter of days and weeks, I went from being just a regular old staff physical therapist to a frontline healthcare worker. I mean, I'm in Rhode Island, and so we surged, I think, about 2-3 weeks after New York became the epicenter.
Mm-hmm.
And Rhode Island is, even though we're a very small state, we're densely populated. And so we surged pretty hard, pretty fast. And so I volunteered to be the COVID therapist, the PT who rehabbed people because I didn't have any risk factors. I was the youngest PT on staff. And so I said, hey, I'll do it, And what ended up happening was, I mean, in many ways, just life-changing. I think everything about the pandemic 2020 COVID has been life-changing to everyone in some way, right?
Mm-hmm.
And for me, it became just me in a, 10 by 20 room with this very, very sick individual who had survived,
Mm-hmm.
and the team had said, all right, we saved them, you fix them. And I was like, okay, well, I've never seen anything like this before. Am I going to help them? What if I hurt them? What do I do? And so I just love to learn. And so I read everything I possibly could, from China, Australia, Italy, anywhere that came before us. I read anything and everything that I could get my hands on and have translated.
Mm-hmm.
And a lot of it was taking my, at that time, 7 years experience
Mm-hmm.
and saying, oh, this looks like this looks like that, this looks like this, and figuring it out.
Mm-hmm.
It was just a truly rapid and incredible transformation.
Yeah, it
Yeah.
sounds good.
Yeah.
So how did it go from working in the hospital to then creating the Rising Tides Restorative Training?
Yeah. So I always had a slight disdain for healthcare, even though I worked in it. I think I've always had this view of it's not doing what it really should be doing.
Yeah,
I
joint
think,
it, kind of like the way it's set up.
yeah, I mean, and your background is in healthcare, so I know you've been exposed to probably what I'm talking about, and I started rehabbing, these individuals. April 2020 is when I started seeing my first cases, and I started seeing more and more. And like I said, I was in these rooms in isolation for hours, gowned up head to toe, and it was just me, this individual, a bed and a chair, and I was expected to get them home. Because we weren't allowed to go to the gym, the rehab gym. We weren't allowed to leave the room. I wasn't really allowed to bring equipment in because we weren't sure how we could keep it decontaminated and things like that. And so I became really close with these people because you just have to get creative,
Yeah.
And so I figured out I could hack into the computer system and get to YouTube. Don't ask me how, but I was able to. And we just started playing music. And so that became our therapy sessions, to get up, to move, to walk. And there was one individual in particular, his name was James, that I was working with, and he had been in the hospital for over, I think it was over 40 days. And when he came to us, like, he could hardly stand up with a walker. And he and I became pretty close because we had a lot of shared music interests and got moving. And I remember he was one of the first few people that got discharged home, and it was like this big deal, like, yeah, like, you made it, like, you're going home. And he got discharged on the day that I wasn't even working. And so I didn't want to miss it. And so I put my 2-year-old, almost 2-year-old son in the car. I said, come on, like, we're going. And so I parked outside the hospital. I had my cowbell ready because he was going to walk out of there. And it was going to be the first time in over 40 days that he was going to get to see his family and hug them.
Yeah.
Like, and that was so awesome and such a proud moment. But then a month later, the OT that worked with him did a follow-up call to check in, a post-discharge follow-up.
Yeah.
And she pulled me aside. She was like, oh, I talked to James today. I was like, how's he doing? It's, so great that you were working with him, and what's he up to? And she said, well, he's really depressed. I'm like, what?
Yeah.
He's really depressed. He hasn't made any progress. He's not back to work. And I was just in disbelief. Like, I couldn't believe this. It'd been a month. We got him to the point where he was walking with a cane. And, in my head, I was thinking, even the worst home physical therapist, there's still the chance for natural recovery. Something should have changed.
Yeah.
And it was just that moment of, oh, what is going on here? Like, this is not normal. This is not right. And then I started seeing a lot more of James, where, we would only get them so far, and then they go home and that was it. And also, while I was working with these people, we would see a lot of weird things, right? Things that weren't respiratory. Like, we thought we were just working with a respiratory case.
Right.
And so I just started becoming, like, really disappointed. And I think that disappointment became some anger, right? That like, we're not helping these people. We're
Right.
not doing it right. Like, there must be something wrong. And
Mhm.
then I started hearing about someone, so Hannah Davis, who is one of the founders of the Patient-Led Research Collaborative, having this prolonged experience. And I don't think it was called long COVID yet. And the reason I heard about it is because I grew up with her. And so I started putting it together. I'm like, wait a minute, something's not right here, right? And I just felt this fire, this fire and this passion that if we couldn't help the sickest of the sick, then what's happening to the people in the community, right? And so I had to do something. I just had to. I couldn't, my impact alone in those 4 hospital walls was not enough. And so I set out on a mission in 2021 to launch my virtual COVID recovery program. And basically, my first mission was to sound the alarm. That was it.
Yeah.
Sound the alarm. Yeah.
Yeah.
Yeah. Because there were so many people that just had no idea what was going on.
And still don't.
Right.
But better than it was.
Yeah. And I think another piece that kind of maybe gave me a little bit of a leg up in kind of having this whoa moment was just before 2020, late 2019, as it would have it, I had started working with someone who had POTS and autonomic dysfunction. Well, 2 separate cases. And so it was on my radar and in my brain.
Yeah.
And so then I kind of had these, wait a minute, hold on, I had these moments. And so I just felt as if I had to do something. And so that's when, like I said, I launched my business. And since then, I've been practicing for 4 years. I'm no longer even in the hospital anymore. I've phased myself out, which in many ways is amazing. I mean, I also wish we weren't in this position, but I've been doing this now for 4 years entirely, and have helped over 200 individuals at this point between, one-on-one work, group programming, guided breathwork sessions, and now I realize I'm one person. I can't help everyone. And so that's where I've really tried to see how can I educate more PTs, right? Because I'm only one person.
Right.
Yeah. So it's just been an incredible experience. And it's in many ways, I think I had to undo and unlearn everything I knew as a PT in order to be in the place that I am today and actually help people.
Wow. So I understand what you mean when you're talking about trying to unlearn everything that you thought you knew about. Because I think all of us with long COVID have gone through that in some way, trying to do gradual exercise and, and like falling on our face and that sort of thing. So it's so cool that you have, not only that you've created a company that's just to help people, but that you also have been spending so much of your energy to try to educate other physical therapists, because you're right, like one person, and you're going to reach so many more people by educating and by doing podcasts and stuff too. The more people will hear about you here, but it's just like the education piece is really key. Yeah. So thank you for being here.
Well, thank you.
So do you have any tips or tricks for people with long COVID?
Oh my goodness. Tips or tricks? I mean, which category do you want to start in, right? I mean,
whatever you want. We've got all the time in the world.
I know. Well, so I think kind of going back to what I was saying about unlearning a lot, I think I want to touch upon that, because then I think it will maybe set up a better understanding of some quote unquote like tips and tricks, or tips and tricks. And I think it goes to that with long COVID, there are so many versions, right? And that was part of my main message up front was, one, let's sound the alarm that people are not just deconditioned, or they're not just, lazy, or
Right.
all of the things that have been labeled, or just right, or just depressed, or it's psychosomatic, meaning kind of like it's all in your head, right?
Yeah.
So, I mean, I think that was the first thing that needed to be done. And then from there, it was then kind of saying, hey, we're not all apples here. There's apples, oranges, pears, pineapples, and there are different versions, and we can't talk about this as a whole. And we need to talk this more about individual phenotypes, right? And so, I mean, even before we knew what those phenotypes, I just knew that there were different versions based off of what I had seen in the hospital. And then early on, when I started working with people, I had, people who had post-exertional malaise and people who didn't, right? So I really had to unlearn everything that was taught to me in the sense of, exercise is medicine, and overload principle, that in order to get better, you have to overload. And literally that is what we're taught in terms of rebuilding bone, which is Wolf's Law, that you need to have weight bearing and overload. With muscle, you need to have overload because then it breaks it down and builds it back up stronger. I had to undo all of that. And that was hard. Kind of like an ego death, know? But once I realized that, then, I realized that, okay, my entire background is physical therapy. I am a movement expert, and so many people can't tolerate movement. What am I doing here, right? Like,
Totally.
Who am I? What do I believe in?
What's your purpose in life?
What's my purpose in life? But I kept coming back to the core that movement is medicine, right? And I know that exercise is controversial in this space. So, if you hear me say exercise, sometimes it slips off my tongue, and just because of ingrained patterns, but movement, right? Movement, exercise. And so what I ended up finding is that it came down to, how can I get my body ready to handle movement? Right? And so, the people without post-exertional malaise, and I want to back up. I don't want to assume that everyone who's listening knows exactly what post-exertional malaise is. I think, for those who don't know, post-exertional malaise is basically, if we break down what it says, malaise is feeling unwell, post-exertion, meaning after you exert. So you feel unwell after you exert. And exertion can be physical, cognitive, such as thinking, emotional, positional, environmental. It's anything that puts stress on your body. And so for these individuals who didn't have post-exertional malaise, or PEM, right, they could tolerate movement or exercise, but they also had their limits where they would hit a wall, right? And so there was something that wasn't adding up. They weren't ready for that level of movement. And so these were the people maybe that were, hey, I can walk 2 miles a day, but I can't return to running. Like, every time I return to running, I can't. I experienced this, that, the other, blah, blah, blah. Then, there were the people who were, if I go up and down the stairs too many times in one day, I'm floored, right? And so what I realized is that in both scenarios, still needed to set them up to be able to handle movement. And so what it came down to were foundations. And so I hear, I love tips and tricks, but I'm a foundations girl, And so I think the foundations are, which is kind of what I center everything around, are kind of these main pillars of breathing dysfunction. So correcting any breathing dysfunction, meeting your metabolic needs. So meaning just eating enough to meet your body's demand for the day, stabilizing mast cells, which not everyone has some type of inflammatory component or histamine component, but can't ignore that when it is present.
Right.
And then understanding recovery strategies, which kind of goes along with pacing, but it's really more about how do I recover after I've exerted,
Mhm.
right? And so what I can do, if you're open to it, I can kind of briefly touch
Yeah,
upon each
go
of
ahead.
them. Yeah?
Yep. Yep.
Okay.
We get to do
So,
whatever we want. It's
gosh, isn't that just amazing? Isn't that the best? The best. So I think maybe the best way to understand these is if I put it kind of in like a real life scenario, okay?
okay.
So I'm gonna take Tommy. So I'm gonna use the example of Tommy, okay? So Tommy was an actual person that I worked with. At the time that we started working, he was 27-year-old male,
Mhm.
and he had for about, what was it, 8 months? Yeah, 8 months, had no idea what's going on with him.
Wow.
Racing heart rate, chest tightness, shortness of breath, significant fatigue, and then ultimately panic attacks so severe on 2 occasions he went to the emergency room.
Mhm.
And I'm sure, maybe, yeah, I see you're shaking your head. You're like, yeah, this sounds familiar. Maybe some people who are listening to this are like, oh yeah, like this sounds familiar. But he had no idea what was going on, and he was seen in the emergency room, and guess what? Everything came back normal.
Right.
Chest X-ray, blood work. He's not having a heart attack, so he is fine.
Right. Right.
Right? He's just having a panic attack.
Right.
And so, he was sent home with anti-anxiety meds, told to start therapy, and he did that. And okay, he saw a little bit of improvement, but still had significant anxiety, fatigue,
Mhm.
chest tightness, chest palpitations, heart racing. And he's 27 years old, and the only thing he can tolerate is getting to work and coming home. That's not normal for a 27-year-old.
Mm.
No, and so what we ended up finding out was that he had autonomic dysfunction. He had POTS, which is very commonly associated with long COVID, but not the only version. So I want to make that clear that it's not the only version. It just happens to be, I think the last time I checked, like more than 3/4 of cases of long COVID are autonomic dysfunction and or POTS. And so for those of you who are like, well, what's that? POTS, postural orthostatic tachycardia syndrome, is basically where your body doesn't respond to being upright. But it's not just that. It's a dysfunction of your nervous system where you don't respond appropriately to stressors. So one of them being upright, another one could be food, can also be exercise, it can be social or environmental, like, intense sounds or intense visual things. There's just so many things in which it could trigger the nervous system, and then your entire body goes a little haywire. Okay, to kind of keep it short. And here's this 27-year-old guy who's terrified he's going to drop dead from a heart attack. And that's a very real feeling that I know a lot of people feel. I mean, he wouldn't even go hiking with his buddies because he's like, there is no cell phone service out there. If something happens to me, I'm not coming back. And again, he's 27. And so what we did is we took those foundations that I was talking about, right? And we worked on his breathing, because the thing about, to be honest, any version of long COVID is that there's always some type of breathing dysfunction. And that's, I've just seen that across the board. I mean, even if we look at cases that are just respiratory based, there's research that shows that the virus can invade the diaphragmatic tissue, which is the muscle that is responsible for effective breathing. So, there's just so many angles to this that everything comes back to restoring normal breathing. So he had an abnormal breathing pattern, which when you're not breathing normally, it sends signals to your body that you're in danger. And when your body thinks you're in danger, then everything gets ramped up and heightened. Right? And so we get all these weird symptoms, quote unquote, weird symptoms, but it's really just your body in this heightened state. And so, by correcting his breathing pattern, we were able to reduce his his racing heart rate, some of those chest palpitations and chest tightness that he was getting, and kind of just take the dial on his nervous system and turn it down a little bit, right?
Right.
And so we didn't even go anywhere near exercise or any form of structured movement. That was the first thing we did. And then it was, okay, well, let's take a look. What are you eating? Well, he wasn't even eating enough, So what we realized is that he wasn't eating nearly enough protein to even meet what he needs just to be alive that day, And so again, that's another signal to the nervous system that you're in a state of danger, right? You're not eating enough to fuel your body. Your body's going to go into survival mode, right? It's going to ramp that dial, the nervous system back up. So we said, okay, I said, let's start getting you eating some more protein, some more calories. We'll round it out with, carbohydrates, fats, right? It's not all about protein. It's let's bring everything up a little bit. And in that process, we discovered that he had a little bit of histamine intolerance. So paired him up with a dietitian to kind of help that piece. And from there, it was like, wow, he had more energy. I remember he messaged me to tell me that he needed to, I can't remember why. Someone in his family, I think, needed to move all of a sudden, and he had to help move a mattress. And he was so excited that he was able to lift this mattress and carry it without getting short of breath or chest pain, and he didn't crash.
Oh, that's great.
And
what a victory.
Yeah. And you're thinking, wow, okay, lift a mattress, but that was huge.
Yeah.
That was huge, And so it was the stuff like that, those foundations of just restoring the normal breathing pattern, giving his body enough fuel, tons of pacing, right? And so in terms of talking about recovery strategies, I think the way that I like to approach this is almost as if each person with long COVID is an Olympic athlete. And I know that sounds like an oxymoron.
I love that.
It's I know it sounds like an oxymoron, but hear me out for a second. So what do Olympic athletes do, right? They train for peak performance.
Right.
Right?
Yeah.
And as part of their training, they fuel their body, right? They time things. They double, triple, quadruple down on recovery. Think of those athletes going into the locker room doing ice baths, massage, having their post-workout high protein, high calorie shakes, whatever. All that applies to long COVID. It's just that different goals, right? They're training to do a 100-meter dash, and you're training to get in the shower.
Right.
But, that's what I'm talking about in terms of teaching pacing. It's also about the recovery strategies. It's not just, it's kind of like bookends. What am I doing before? What am I doing after? And then there's the stuff you do in between, right? And so it wasn't until he felt really confident and we both felt confident that he had a handle on how to recover that we started introducing any type of formal movement.
Okay.
So it was
Let's the process down before you start to
right? Because it's kind of if you think of giving a 16-year-old a license to drive,
right?
You want to make sure they know the rules of the road before they get on the road,
You don't send them off on a road trip cross country
right.
just to get their permit.
Yeah, have them practice driving in the cemetery where everyone's already dead before.
Right.
Right. So again, I'm a foundations person, right? And I think that's what I believe in more. Tips and tricks, if you want to give me a category, I can shout things out almost whose line anyway. But I think that's what I really believe in, and that's what I see helps people is getting down to those foundations. Now, in terms of breath work, I think you've talked about different.
No, we haven't on this podcast, but the Long COVID podcast has done a lot.
I know they talk about it a lot. Yeah. Well, I think, the thing about breath work is that there are many different forms, right? And so each one comes with a different intention. And for some people, doing breath work can be triggering.
Sure.
If you pick, I don't want to say if you pick the wrong one, but if you pick one that's not meant for you in that moment. And so, you know, a lot of what I really emphasize with people is relearning how to connect with the diaphragm. Because I see a lot of people who are using a lot of their upper chest muscles, which are called our accessory muscles, and they are part of breathing, but they're supposed to come into play when we're sprinting or exerting really hard. They're not supposed to come into play when we're just sitting at rest. So, you know, what I teach people is how to connect with their diaphragm and essentially exercise their diaphragm, right? Because just like any other muscle in the body, it can atrophy or get thinner or lose actual muscle mass. And so, you know, that's I think where I tell people to start the most. And it sounds so simple that it can't be, like this can't be a thing, but simple goes a long way, right? And we don't have to make rocket science out of everything. You know, I get that there's a lot of medical complexities and there are many scenarios where medication is helpful and necessary. And it's also, you know, the question of what are you doing at the foundation of your lifestyle? You know, and the thing about autonomic dysfunction and POTS that maybe people don't know is that the first line of defense is actually lifestyle changes over medication. And so when we're saying lifestyle, we're talking about, you know, pacing, breath training, nervous system regulation, exercise when it's appropriate. All those things are the first line of defense, right? So again, you know, I'm about the foundations, but with Tommy, in terms of breath training, right? If I were to tell someone where to start, getting on the floor, putting your hand on your chest and your hand on your belly, and just sitting there and observing what is my body doing? What do I feel moving? Do I feel my chest moving? Do I feel my belly moving? How much? How fast? And this is the kind of stuff that we did with Tommy, is just to create awareness, right? You know, and this is something that you guys can do right now as you're listening to this, you know, put your hand on your chest, your belly, and just see what's happening. Don't try and change anything, just observe, right? And then once you get that awareness, you can try to think about if you had a balloon in your belly and you want to fill up that balloon, right? Breathing in through your nose and out through your nose. And that's how you can start to connect with your diaphragm. Right? So thinking that there's a balloon in your belly you want to fill up and making your hand rise up away from your belly, pushing it, you know, but that's where we started with Tommy. And then by the time we ended going through multiple progressions and, you know, introducing movement, I mean, he was back to playing flag football.
Wow.
Pick up volleyball games. He was lifting 3 times a week, biking 2 to 3 times a week, and just he felt confident enough that he actually booked a trip overseas, you know, and so, you know, this didn't come without setbacks. He got a reinfection, you know, and so we had to navigate that. But, you know, I think a lot of people get stuck, right? Because there's a lack of support. There's a lack of guidance. There's the fear of, is this the right thing for me? And if I try it, is it going to help me or hurt me? You know, and what I really want people to know is that there is always more, right? And I think a lot of it is coming back to the foundations over and over and over again.
Cool. I like it.
Yeah. So one other thing I wanted to mention is that one of the things that I've also included in terms of breath training is a different form of breath work that I've gotten certified in. It's called the reset breath work or the reset method. Essentially what this is a long form conscious connected breathing. So a lot of people might if they hear that and know a little bit about breath work, they might think Wim Hof method, which this is not that. Wim Hof is very active and it's for a very long period of time. This is, where instead of just doing a couple of breaths, you're doing it over, 20 minutes. Okay. And the pattern of it is designed to help regulate your nervous system. So what I've been doing is for people who are exercise intolerant, using this as a way to help bridge the gap. Because essentially the way that this type of breathing works is that when you're going through the cycle, it actually brings you a little bit into sympathetic. So we're talking about a little bit into fight or flight. Okay. And you're in control of how far you go. And then by the end, it drops you into a deeper parasympathetic state. And so if you think about what exercise is, right? Exercise is going into a planned sympathetic state or fight or flight, right? But then afterwards coming back to recovery. And there's so many people with long COVID or POTS or a combination of the both where their heart rate spikes. They have no problem going up.
Right.
They go into that sympathetic state, but their body doesn't know how to come back. And so this breath work helps teach that. I can go into a little bit of stress and I can recover. And that exposure helps to train and teach the nervous system. I can do this, right? It's not just I go there and I don't come back.
Yeah.
And so this was something that we also incorporated, with Tommy at times to help kind of teach the nervous system, because sure, it's great to be able to bring your symptoms down. That's so important. So important, right? And to be able to get into that parasympathetic state, but we're not designed to live there.
Right.
We're designed to be flexible. We're designed to be able to go into states of stress, whether they're planned or unplanned, and then come back to them, right? Be able to handle the traffic and the crazy
Homeostasis.
Yeah, you got it. Exactly. Homeostasis. It's that balance, that ebb and flow, and so I think that's why I love this form of the breath work so much, is because it helps you have that ebb and flow instead of just always trying to go into that deep parasympathetic state. Yeah. And never retraining any tolerance again.
I like that idea of bridging by like forcing yourself to do a little bit of sympathetic and then going back down and kind of, that's very interesting.
Yeah.
Okay. So the last bit is just like any pearls and how do people reach you?
Yeah, absolutely. So, I definitely want to share how to reach me, but
Okay.
I think what I want to just leave people with is a reminder that your illness doesn't define you, and I don't think people hear that often enough. And, you're so worthy. And again, I don't think that's said often enough, and it's important to hear that. But, if you're listening to this and, you're, I don't know, horizontal, in bed, legs up, or however you are, I just want you to know that. And if you're wondering, how am I going to get out of this position, figuratively, literally, whatever, and tolerate being vertical again,
Right.
just know that there's always room for more, right? When you come back to the foundations, and that there's a chance to be able to tolerate more, right? So, if you're listening to this and you're interested in actually trying that form of breathwork, the reset breathwork method, you can go to my website, and if you go to the section about breathwork and use the code BREATHE100, so that's BREATHE 100, then you can come and join one of my monthly breathworks for free, and just try it out and explore what it's like to feel that experience. So I would love to see some new faces and share some breathwork with people.
That is awesome. And we'll put all of your stuff in the description of the episode too, so you can find it there. Thank you so much for coming. It was so nice to have you. And I feel like you brought so much to the table with all of your knowledge and your experience and in bringing some hope, it's easy to fall into not having a lot of hope. It's just nice to have a breath of fresh air and new ideas and, stuff like that. So
yeah, absolutely. I mean, I'm very passionate about this, so I just want to touch and reach as many people as possible.
Totally. And can you come back if we ever need to go over the other things? Are you happy? Okay. Good.
Oh yeah.
Yes. Okay. Good.
Bring me back for any topic you want.
Okay.
Well, as I said, when you said tips or tricks, I said which category?
I know. That's good. I mean, it means you have a whole lot of them. You've got a whole arsenal of them.
Absolutely, anytime. I mean, I tell people all the time that I could talk to a wall, and it's true. I could talk to a wall, and I love to teach. So, a dangerous combination.
Perfect. I love it.
Yeah.
Okay. Well, thank you everybody for listening. Thank you again, Dr. Meg, for being here, and we will talk again real soon. Okay.
Thank you.
Take care.